Hello and welcome to Autistically Wired, a conversation that highlights autistic people as professionals, creators, entrepreneurs, and community contributors. I'm Brooke, your interviewer for today's conversation. I'm a late diagnosed ADHD woman, an entrepreneur, and an education professional, and it's really meaningful for me to be a part of these conversations and help create a space for autistic voices to be heard and valued. This series centers what becomes possible when autistic people are supported in being our full, authentic selves rather than focusing on deficits or barriers. These conversations are strengths based, flexible, and guided by each guest's communication style, pacing, and preferences. Today, I am honored to be joined by Dr. Stacy Greeter. Dr. Greeter is a double board certified psychiatrist in child, adolescent, and adult psychiatry. She graduated summa cum laude from Duke University, attended UNC School of Medicine on a full scholarship, and completed her residency and fellowship at Northwestern Memorial Hospital. Alongside her clinical work, she's deeply committed to expanding access to high quality psychiatric care, as well as mentoring, teaching, and supporting interdisciplinary collaboration. She also serves as a board member with Autistic Career Pathways and is known for her creative, neurodiversity affirming advocacy. At age 40, Dr. Greeter discovered she is an autistic and an insight that profoundly reframed her life and experiences. She now brings both her professional expertise and lived experience into her work with a focus on strengths based affirming approaches to autism and a deep commitment to supporting neurodivergent clinicians and communities. I'm really looking forward to hearing more about your journey, your perspective, and the work that you're doing, Dr. Greeter. Thank you so much for being here.
Hello, Brooke. Good to see you.
Good to see you too. I love that you're wearing teal. That's one of my favorite colors.
Yeah? Cool.
It
Very
speaks to
cool.
my painting.
I see that. I see that. I like the painting behind you. It's nice. Goes well with your hair too. It's kind of
Oh,
cool,
thank you.
right? Nice to see your face.
Yeah. So I'm really looking forward to hearing more about your journey, your perspective, and the work you're doing, Dr. Greeter. Thank you so much for being here.
Thank you, Brooke.
So you realized that you're autistic at 40, which is such a big and often emotional shift. What was that experience like for you? And how has it changed the way you understand yourself and maybe even the way that you show up for your patients?
Such a great question. I think that um, the first big shift for me was in accepting that I did not have a full understanding of what autism is, even as a psychiatrist, who, I'll be honest, I had considered myself to be somewhat of a quote expert in autism. And then knowing I missed autism in myself was humbling. I think it really um, taught me the importance of humility and openness to changing my perspectives as a physician, um, because what we're understanding about autism has changed so much since my residency, my fellowship, all of that training. Um, so to be able to update our prior assumptions, our prior teaching and understanding, I think is so important. And so I had to grapple, I think, with some autism diagnoses I had missed in my patients. And, making peace with that was hard. I think that could be a big barrier maybe for other clinicians in changing and shifting their perspective on autism because then we have to accept that we were wrong. Um, and being wrong is a really healthy, awesome thing to be on a regular basis because it means that you're learning. Um, I think personally, so then I could bring in an even, I think, greater level of humility into my work with patients. And personally, it felt, I think, freeing in many ways of to have a thread that kind of fit through my young years to current years to understand some of my struggles and reframe them from shifting from, oh, that weird, selfish, too much uh, descriptors into like justice sensitivity and um, differences in communication styles and differences in um, what excites me and interests me compared to others. Um, I think it, I mean, I have to laugh a little bit. Like, psychiatry for me, I realized psychiatry is my job, yes. Psychiatry also happens to be my autistic special interest or one of my autistic special interests. And I felt kind of lonely. I was like, why don't other psychiatrists want to hang out and talk about psychiatry? Um, and I'm like, oh yeah, it's because it's not their special interest. It means something different for other people. And there is some judgment, I think, even some self-judgment, like, you need to have work-life balance because you leave the day from doing psychiatry and then want to listen to psychiatry podcasts and read psychiatry stuff and make fantasy themed psychiatry presentations. What the heck is wrong with you? And now understanding like, oh, so there's like psychiatry as my job, and then there's psychiatry as my special interest, which are different ways of engaging. Um, that was really helpful. So my PA said, yeah, that helps me worry about you a little less. And I think it really helped me to more authentically understand how the lens through which I view the world and communicate is different than the holistic lens. Um, Definitely helps me in my work with patients and then just out in the wild with people in general.
So, with the question that I wanted to
Hmm.
ask was, as someone balancing a high responsibility career with chronic illness and evolving
Hmm.
self-understanding, so what kinds of self-advocacy boundaries or practical supports have been most important for you?
Hmm. Okay. So I don't know if I'm balancing it very well. Just gonna throw that out there at the get-go, right? I am in an ever chronic process of trying to balance it. Um, like I had to cancel 2 days of patients next week because of being in a like major energy crash. Um, and so I think one thing is to try to not shame myself when oh, I thought that working 4 days a week would be great during this time. Nope, not so much. Like I have to adjust. Um, because I feel a lot of like, I would say the feeling of letting people down. And there's a lot of high responsibility. And I would say in my medical training, um, there was a huge emphasis on A good physician is one who forgoes their own physical and psychological needs in the service of others. Yeah, your face looked like surprise, but yeah, that's the message. Okay. That's what a good
I
physician does.
muted to give you space, but yes, I was shocked because
um, I mean, I have a good therapist, yay, who helps me because I mean, let's be honest, guys. No wonder people are complaining about their doctor not being empathic or spending enough time with them or this or that. Like if their physical and psychological needs of the physician are completely not met. Um, so reframing that through my own therapy and noticing just so I can like notice um the shame I hold of having to cancel patients due to illness and not give into it by pushing through and seeing patients anyway is a constant battle. Um, I I think that it's very important though. It's very important or I will do my patients a serious disservice because then I would not be able to show up fully with them. Um, And I think that preventing, like taking care of ourselves psychologically and physically is more than just like, oh, it's good for the doctor. It's a moral imperative so that we can be showing up for our patients fully in their vulnerable state.
when you're treating autistic people, do you notice that a lot of the burnout comes from that sacrificing their own needs in order to show up for other people or perform a
Yeah,
certain way, appear a certain way?
I think so. I mean, I'm also gonna like, I mean, yes, I think that this is multifactorial. So, um, there's yes, the fear of letting people down. Okay. There's B, unreasonable expectations of what you should be able to do. And then I think C, I think this is an important one. Um, there's a reason that hmm, I get a lot of fulfillment and joy and feel really good when I see more patients. That doesn't happen when I see less patients. So I think we need to recognize like this is the ADHD part of me too, especially, right? ADHD wants to always do more. It does not like resting. No, my ADHD like feels like rest is a dirty word. What the heck? It wants to do a bazillion different projects to change the world today. Um, so I also have to be aware of how um it is very like reinforcing and there's something that I really get out of pushing myself and doing more. And like we get reinforced by society as well as ourselves for over functioning and like a positive feedback loop that can keep us stuck in that. You
That's
know,
something
like even when
that
I like go to the gym, like another thing I'm working on for my chronic illness is like pacing during my workouts so my heart rate doesn't get to a certain point. And I'll notice like I would be on the elliptical in the past, and people at the gym would be like, wow, look at you going so hard on the elliptical. Nobody is like coming over, like, oh, look at you pacing yourself. So yeah, I think this is endemic to society.
and that's something that I can relate to as well as being ADHD and autistic. I love doing all of the things. It felt really good in my body. It was almost like a dopamine rush to like have
Yeah.
all of these projects and be helping in all of these different capacities. But now, even though I'm only in my late 30s,
Uh-huh.
I am really feeling it in my body. And even when I would work out, I'm would go hard. Where now, like you said, I'm working on pacing, and pacing has been a big theme in my life and
Yeah.
incorporating rest. because from my experience, I
Hmm.
have ignored my own needs. So that's why I related and also had
Yeah.
a face when you said that that's what you were trained to do in the medical
Oh,
field.
yeah. I think that, and I hear this from a lot of autistic physicians in particular, that the autistic traits that made them really successful during medical training, like if your interoceptive cues aren't as high and you can kind of ignore hunger and thirst for a long time and like really hyperfixate for a long time and forgo rest, and like you can get that gets praised in their medical training, and then they end up in burnout. So I think that autistic physicians, for so many reasons, you know a like it's like the sensory overwhelm or masking demands of the workplace, just that medicine and what we expect of physicians is kind of bonkers, cuckoo, um, not healthy, right? And um, see the moral injury of not being able to do for the patient and what really needs to be done, like care for them the way that they deserve care because of the medical system being so screwed up, right? And then like all of that leads to massive burnout in autistic physicians is a big issue.
So when we were talking before in the pre-interview and in our emails, you had shared that there were parts of your medical training that didn't always feel like the right fit. And
Right.
I would love to hear more about that. Like what felt challenging and how did you start recognizing that psychiatry was more of a space where you could thrive?
So I think it was a shift probably to private practice. That was really a good place for me. Though it certainly has its downsides. I Medical training, it's hard because the there's like the cultural role of a doctor, right? Like how does a doctor talk, present themselves? Um, it's like a whole new subculture within holistic cultures of like doctor culture, right? Um, and I've given some presentations on this on my YouTube channel if people want to do a deeper dive, but we've come to refer to it as the quote hidden curriculum within um, medical training, right? Um, so like on the surface, they'll say, "Oh, ask any question," but really the hidden curriculum is like students should really be seen and not heard. um or like, yeah, we're totally evidence-based medicine, but then hidden curriculum says don't challenge your attending if they have a deep belief about something, even if it doesn't quite fit the evidence base. So a lot of like really maintaining the stability of the hierarchy structure of like med student, resident, fellow, attending. Okay. Um, I'll give you an example. Like, um, there's so many examples. Um, I I was trying to figure out, there's a lot of like controversy back when I was in residency about like what was or was not pediatric bipolar disorder, and what would constitute someone actually at a manic episode. Um, and so I was like, yeah, I'm just gonna like ask a bunch of people about this topic. And then it came to light the attendings found out I was like asking all of them the same question. I was sort of like making a data poll, right? And so I got um like put on remediation so I could only be with one attending so I wouldn't be asking. They said I was fishing for the answer I wanted, something like that. Um so it's offensive, right? It's like obviously medicine is subjective and there is no right answer a lot of times and it's ever evolving. Yet there's this culture in academic medicine, almost in training, like there is a right answer. You give me the right answer, good. And I know the right answer as the attending. Um, and so examples like that make it really hard. I think that a lot of the qualities that make you successful in showing up as a student in training in medicine are like opposite to the qualities that can make you successful in showing up as a physician with your patients, right? Such as curiosity, humility, openness to the subjectivity of medicine and differing perspectives, um, being vulnerable and open and sort of like a fellow traveler as opposed to a professional physician looking down from, I don't know, Mount Olympus Physicianville. Um, and I don't want to be like, I mean, I think also um the there were attendings who were amazing teachers for me, and there are ones that were just a terrible fit for me. And I was very confused about like what's going on, right? And I think that um that is because being autistic, you know, I think other students can much more easily be like a social chameleon and just kind of show up the way that particular attending wants them to show up. And I'm not a high masking autistic person, actually, right? So it was kind of like, um, it was harder for me to totally shift my social approach and style based on whoever was like happened to be grading me that month. Yeah, so that I don't want to I could keep going, but yeah, did that answer the question?
It did answer the question. So
Whereas with patients, I think showing up authentically is super helpful. Like they
hmm
like being really down to earth can be really helpful.
Yeah. And it's interesting what you said about the energy that, or like being able to mask in order to please different people. That has been one
Yeah,
of my biggest barriers. And I find that even doing these interviews, I get exhausted because I want to make sure that I'm affirming, like off screen, I'm like nodding so that you know that I'm here and listening to you.
I feel you being here and listening.
Okay, good. There was something else that I wanted to bring up. Oh, how in the medical field, I think one of the hardest things, and you had shared that this was part of a moral injury too, is how the medical field is ever evolving. And so, how you could diagnose a patient with one thing, for example, or treat them with one thing, and then more information comes out, and then you find that things are completely different. Maybe they have a completely different
Yeah.
diagnosis, and how that, excuse me, would impact that patient. And how do you take care of yourself with situations like that?
Okay. So, I mean, first of all, I think it's important to validate oneself. Like, man, when we miss something with our patient, um, it's it's healthy for that to hurt because we care. Okay? Like, like that's not like there's nothing pathological there. There's nothing that wrong about that. That's healthy, right? You cannot practice medicine without getting it wrong. constantly. And so I think just embracing that as part of the process, first of all, right? And wrong is really a reductionistic word because I think the longer I have been a psychiatrist, the greater appreciation I have for how complex and subjective medicine is. People always think it's like a plug and play thing. Like you get a test and then it rules out or rules in autism. It's like, no, no, not really. Right? Diagnoses are so clear cut and people are so complex. So it's always our best approximation, best educated guess. And people change and diagnoses change. I hope, right? Because we're evolving. Um, so I think coming in with that, um, like really cultivating one's acceptance of one's own fallibility and acceptance of the ambiguity of the work of medicine, combined with the high stakes and high responsibility of quote messing it up. And that's hard. Like I like this there's high fallibility, there's high subjectivity, and there's high stakes. Um yeah, that and you're like, okay, that's me. I showed up. I'm in the arena, right? Yeah.
So, in your private practice, you focus on autism, ADHD, perinatal mood disorders, PTSD, and OCD, amongst other things.
hmm
What I'm curious, what led you to specialize in these areas, especially with psychiatry being your special interest? Was there something that led you to focus on these particular areas?
Yeah, it's a good question. I mean, I think that's kind of my ADHD showing because so my husband calls them like he'll say, "Oh, you're in a um like I go through phases of different areas of interest and I want to do a deep dive into it." So, I mean, um it was doing a deep dive into updating myself on autism and making a Harry Potter themed presentation about it that I started to be like, maybe I'm autistic, right? So that's how that happened. Um, like there's a whole presentation on my YouTube channel and about autism. And I didn't even know I was autistic at the time, but I was like, what's going on? This is making a lot of sense in my life. So I it's hard to know or predict what's gonna like trigger a new like kind of interest area. Um, I I think the reproductive psychiatry, I wanted to learn more about it because A, I wasn't trained about it very much in my training, and B, there's some there's sort of like a moral injury there in that so many of my patients have gotten negative stigmatizing messaging about medication, psychiatric medication during pregnancy and postpartum period that's harmful to both them and their child. That it was like, I think that the social justice sensitivity in me like wanted to take that on. Um, and then I mean OCD, honestly, like I happened to see there was like International OCD Foundation conference going on in Orlando, and I was like, all right, I want to do a dragon theme presentation for that conference. And then I just took a deep dive there. And then I have an interest in religion and psychiatry, a bunch of videos on that. And I think that was because so I am Jewish. Culturally, spiritually, I'm agnostic. And I'm practicing in a community in which it's primarily Christian, but there's a lot of um psychiatry. There's a lot of like I think fundamentalist Christianity um that's bumping up against psychiatry, and it kind of like believes that taking medicine means you're not relying on God or turning to God enough. Mental illness is something means that you have some kind of spiritual taint, um, or so many things. Anyways, so it's fascinating, and then not even covering everything with religion and sexuality and gender. So I did a deep dive into like religion and psychiatry, um, like rather recently. And then um, I was doing a deep dive into how to be an effective advocate and how we change people's minds, um, which was triggered by um, basically a warning I got from someone before a presentation where they're like, watch out, you could make things worse. Um, what if you present all this stuff about your experience as an autistic physician and people get the impression that if you like share your vulnerabilities, they're going to think, oh, are autistic people okay as doctors? Are they meant to be doctors? So the idea that maybe we should only be sharing our autistic strengths as doctors and not autistic vulnerabilities. So, anyways, that took me into a deep dive about advocacy work and how to be an effective advocate.
But I
So,
really,
yeah, there isn't like one thing that sets this off. Like, what is going to
yeah,
get the ADHD brain to do a dive? I don't know, right?
I appreciate you bringing up that feeling like you need to focus only on the strengths of your autism because otherwise there's this fear of your competency being
Might be
questioned.
questioned. That's a big
But
thing in medicine. I don't do that. I I'm I will happily talk about my disabilities and vulnerabilities, but I understand. I understand the fear because I'm in private practice. I am my own boss. I am much safer than the majority of physicians out there, who could ver who and physicians have been fired for coming out as autistic. So it's I feel like I have this space of privilege here that other physicians don't.
Mhm. And as a person myself, I find hesitation in coming out publicly as autistic too, because, I don't want my competency to be questioned. Where, yes, I
Yeah.
do have these challenges, but I also have a lot of strengths. And that's why, these conversations are important, where, yes, you are being very vulnerable, but you also have contributed a lot to your field with your special interest in all of the presentations
Hmm.
and public speaking, and then, of course, the work in your public or your private practice as well.
Right. Yeah.
And that kind of segues into the
Okay.
next question about how you bring such a creative and engaging approach to teaching, including your Disney and fantasy themed presentations. Can you describe what those presentations
Okay.
typically involve and what inspired you to incorporate these themes? Even costumes.
Yes, I do like costumes. I mean, so yeah, so um another autistic special interest of mine is like fantasy creatures. So dragons, Yoda from Star Wars, mermaids, unicorns, fluffy monsters, the fluffier the better. These are all various themes of different presentations. And I so I love teaching through stories and visuals, fun visuals of different creatures. I have a collection on my computer of different like fluffy monsters just as like a visual stim. And so like the most recent one I did was a fluffy monster themed presentation on how to effectively change people's minds as an advocate. Um, the some of the story ones, I did a Little Mermaid themed presentation with my colleagues. So Ariel discovers her autism diagnosis in adulthood after the diagnosis of her daughter Melody, and Eric is really afraid of this diagnosis, even maybe doesn't want the diagnosis, afraid of telling their daughter about the diagnosis, and they're working through that together, working through changing their parenting styles and their own, um, you know, acceptance of themselves as a family based on the diagnosis. And then Ursula's in there making all the ableist comments. Um, It's a lot of fun. And there's a musical number that I cannot sing. Okay, but Dr. Alicia Cho, my ADHD psychiatry colleague, she's at Stanford right now, working at Stanford. She sings a musical number of Prince Eric wanting to be more a part of his autistic daughter's world and understand. And I always thought that would be a cool concept, right? Like not just the autistic person wanting to be more a part of the holistic world, but an holistic person wanting to be more a part of the autistic world, and there being some balance there. Yeah, so that's an example. And I feel um I feel like it's such a gift if I can send messages that people can really relate to and to be able to um, handle kind of more challenging topics such as ableism, intersectional marginalization, parent not wanting their kid to know their diagnosis, like through a story with a character, as opposed to like telling someone, here's why you should tell your kid, right? There's a character who's like hesitant and scared that they can relate to and see their kind of journey and process.
Would it also be a way of scripting? Because I find that a lot of autistic people really connect, speaking for myself too,
Yeah.
connect to TV, film, shows, because it helps with how to have difficult conversations. And
Hmm.
so having that presentation, which is on your YouTube, and you'll have
Right.
to plug that later.
Okay.
Um, but having something like that, I think, is helpful in showing people how to have these conversations or what the conversations may look like, because
Yeah,
that doesn't always have representation.
it's true. I don't I don't find myself scripting based on shows, but it's okay if people could like use the presentations in that way, of course. Um, yeah. It's almost like people need to kind of get to experience something as opposed to just learning about it a little bit. Yeah. Hmm.
I've enjoyed going through your YouTube channel, which what is the YouTube channel right now?
Okay, the name of the YouTube channel is the at symbol. So at Stacy Greeter MD, spelled StacyGreeterMD. And then I also have a podcast called Chronically Real and Clinically Relevant with my colleague, Ali Garza, who's a neurodivergent therapist who specializes in OCD.
And with Ali Garza, do you do theme presentations too, or is that one?
Yeah, I have. So on my channel, Ali is in my differential diagnosis of OCD with dragons. This is so important to differentiate, like, is it stimming, right? Is it an OCD compulsion? Is it a tic? Okay. Um, and traditionally there has been some significant harm in the OCD world where they tried to treat stimming as if it were an OCD compulsion. So that's some history there. So Allie's in that, and she's also in my Fluffy Monsters presentation on becoming a better advocate, as well as on the podcast. Yeah, so it's cool. I have to, you know, it was hard, um, so hard for me to find a lot of really meaningful connections in my early childhood years, and now I have these colleagues who, we find each other, right? Um, our neurodivergence selves just finding each other and being like, "Yep, I'm on that." Yeah.
And that's what
Um,
I find as an adult is that when you are truly yourself, you attract like-minded people and you find that community that you may not have had growing up, at least from my
right.
experience.
There's definitely a broader community to draw from at least, you
Hmm.
know? Yeah.
All right, next question. So even though we're seeing starting to see movement away from deficit-based models, that lens is still really present in a lot of spaces.
Hmm.
What shifts do you think are still needed, and what would a more strengths-based neurodiversity affirming system look like? It's kind of a big question.
Yeah. Hmm. So, um, I will, I'm gonna zero in on psychiatry. How about to be more specific? Um, I would love if when patients come in to see their psychiatrist, because I'm doing a lot of advocacy in the psychiatry space as a child and adult psychiatrist, um, through specifically the American Academy of Child and Adolescent Psychiatry. Um, and I've created a group for neurodiversity affirming psychiatrists to meet up on a monthly basis, and a working group within the American Academy of Child and Adolescent Psychiatry on neurodiversity affirming care. So I will, I'm hoping that if a patient comes in to see their psychiatrist and they're explaining something like reduction sensitivity dysphoria, that psychiatrist can lead with curiosity. So instead of saying, "Oh, that's not in the DSM. I haven't learned about that. You must have made that up." They could be curious, like, "Tell me more about that. Is there something like a resource you have on that? Let me see. Is this something maybe I didn't learn about?" So leading with curiosity to understand what that lived experience is like for their patient would be more neurodiversity affirming, as opposed to the assumption that if I didn't learn about it and it's not in the DSM, then it doesn't exist and my patient is making something up. I would love to see that. Um, I would also love to see people um, like engaging the patient as a partner, as an expert on themselves, with the physician as an expert on them too. Okay. Um, and I want to be clear too that um, when we value lived experience, that enhances treatment so much. but lived experience is not the only valid way of understanding autism. So we need lived experience with other ways of knowing autism to come together for the good of autistic people. And so the physician is like, yeah, your lived experience, I value it. And here's some valuable stuff that I bring to the table as a psychiatrist too. And we bring it together as partners in this. I would like to see that. Okay. Um, I would also like to see, so they would be curious, like, instead of being like prescriptive of this is how you should do it exactly, this is what will work. They should be more explorative in partnership. What do you think would work for you? Understanding that what works for an holistic person is often not the same thing of what works for that specific autistic individual. Um, and to help that after they diagnose autism, that's just like the beginning of the journey. Okay, that yes, that after the diagnosis is an exploration of, you know, how can you think about yourself differently after this diagnosis? Um, what are some things you can do differently now that you have this diagnosis? What are the hardest parts about being autistic for you? What are the parts you value the most about your autistic brain? And have a balanced discussion. I think sometimes people get confused about strengths-based, and I don't blame them, that means we only talk about the fun, good, awesome parts of being autistic, and it needs to be balanced. It's a blessing and a curse. There are strengths and vulnerabilities. Um, so that, and we hold space for all of that. That's just a few things to answer your question that I would really like to be seeing.
And I think those are all really good things. I think that that would help people in navigating really who they are as an autistic person
Yeah,
instead of feeling judged or like they have to, excuse me, fit into a box or something too.
yeah,
Because there are some times where if I openly say that I am autistic, then people are going to see me some way, or a clinician's going to see me a certain way. I was afraid of that because I'm self-diagnosed, and I brought it up to my therapist, and then I had a list of like experiences and like all of the research that I had done by interviewing people in my
mm-hmm,
family and also different experiences throughout my life. And even my own therapist was like, well, but, in my experience, I'm like, yes, but you're comparing me to a man that you know in your life. Or, well,
yeah,
it was a young man, but I'm like, that's different. Like, it's different with women. But she also was
and
very accepting and like hearing me out. And I shared
yeah.
resources like, this is where I'm getting this information from.
It's okay to have a disagreement with your doctor and back and
Oh,
forth
yeah,
and figure things
it
out.
wasn't bad.
It's all
Yeah.
it's all good, right? Like I think that needs to be honored too. That a patient disagreeing isn't a patient challenging, so to speak, someone's authority, blah blah blah, right? It's healthy.
Mhm.
It's healthy to have a disagreement.
But
Yes.
that's something that I feel like in my life sometimes my challenging or something is seen as challenging when really I'm trying to think about something deeper and I guess challenge it in a way like, well, I want
Yeah,
to know more. I want to hear your side
I
of it
know. I
too.
mean,
I don't think
I
I'm the
feel so
expert.
sad when patients apologize to me for asking questions. I'm like,
Hmm.
no, question's good. Like be an active participant. And it is not rude to ask your doctor questions. Or apologize that they brought in like, a 10-page document with their symptoms. I'm like, look, you're really trying here to understand yourself and really have an accurate representation and try to communicate with me. Great, you know? Um, Now I think it's a very bad systemic issue that see in private practice can I had to choose to not take insurance so that I can spend time with people to like look at their 10-page document and answer their questions. Um Unfortunately, if you're a physician working for a big corporation that takes insurance, then you're going to get um, penalized and in a lot of trouble if you spend extra time with your patients and you're not hitting the like patient numbers or you know, making the office staff stay late because the goal of capitalist or medicine is to see the largest volume of people in the smallest amount of time. Um, that's what, so anyway, so then in that scenario, right? Like questions would be the enemy because they take time. I just didn't, so anyways, I don't want to like in any way like I guess demonize physicians who are struggling and note that it is a really serious systemic issue with our healthcare system.
I'm glad they brought up the thing about questions and um, questions being viewed a certain way or why some clinicians may not be as accepting of questions.
Yeah,
Because as an autistic person, I find that when I was in front of a doctor, I would try and talk as quickly as possible because I knew
right.
I only had like 15 minutes to see the doctor before they went out. And it caused a lot of stress and made it a lot harder for me to see a doctor for my issues.
Exactly. It is really stressful. It's stressful for you. And guess who's also stressed? Your doctor. You're both stressed. You're both like, ah.
So that's why I'm glad that you bring all of this up because all of this is so important for, I mean, people in general. Like, I don't even want to say just for autistic people, but I think these conversations are important for perspective.
Yeah.
All right,
Yes.
last question.
Cool. Okay.
For autistic people who feel like they don't fit the traditional path to their desired career, especially in demanding fields like medicine, what would you want them to know about finding alignment, meaning, and even alternative ways forward?
Yeah. Okay. Trying to answer that in 1 minute. So I think a lot of times the skill set to get through training, a training program is super different than the skill set needed to be successful in a particular career, just because of how formal education is set up. Um, so my advice would be try to get mentorship and talk to people who are in the field already. Um, and like even if you have, like, see if you have an ally slash mentor in the field who can help you to grow and give you like reasonable feedback that you trust. Not feedback like, hey, be less autistic, but you know, right? Really good, healthy feedback for you. Having a mentor and someone you trust and someone who can be an ally to you can be extremely powerful. And also, it's okay to change jobs. A lot of um, people get stuck, and it's the devil they know. It is scary to change, but it's okay to change and make a shift. Like I thought academic medicine would be for me, and it's sad. I wish a lot of times I was at an academic center, getting to be involved in a big academic community, but I'm basically allergic to academic hierarchy and politics. So here I am in private practice, and that's how it goes. So just recognizing that if it's not meant for you.
I appreciate that. Thank you so much for being here and
Hmm.
for sharing your experience and also giving advice to people. So, thank you
Thank
so
you
much,
so much,
Dr.
Brooke.
Stacy. I hope you have a great rest of your day.
Thanks. Bye.
Bye.